1997, I was raped on my way to work. And I didn't know that time. I wasn't even sure that I was raped. It took me some time to understand it. And I went for the test after like 3 weeks. I was still confused. I was very sick after the rape. I struggled with it. And then I tested positive. I didn't tell anyone here in my home. I didn't tell anyone here that I was raped. I just said I was robbed. I felt so bad about being raped. I really felt so dirty. And the way I was treated in the police station made me feel filthy. Okay, this is where I was in 1997 when I was raped. Okay, ndafika ngizoreport case ne. Ndafela phezu esitulweni and then ndabuzwa lipolisa pha ufuna ntoni sisi ngingakunceda ngantoni. Ndisoyika but ndirechiwe. It's another rape case again, and that was the response in 1997. And I was very scared because there were a lot of people in front of me looking at me. She's raped and she's like different from other people. She's dirty. So I just marched out of the door. But now, what's happening now, I always take people to the same police station, the rape victims. And then now you just tell them, sorry, it's private. I can't talk in front of people. And then they take you to these rooms inside here, so that you can feel a bit more comfortable when you're sitting here. You can talk everything, you can cry, you can do anything, because there's no one watching you like it was before. They take you straight to Tutuzela project, where you got the access of the rape post-exposure prophylaxis, where you can prevent the infection of HIV. So people must report the rape cases to police station. It's never like before. Everything is different now. You can prevent infection, you can survive.
I was very lucky because 2 weeks before I was raped, I went to Chris Hani Baragwanath's perinatal HIV unit. I was writing a lot on AIDS. And a field worker there who's positive, Florence Ngabeni, she said to me, the very last word she said was, Charlene, sometime you must write about the fact that you need antiretrovirals after you're raped. And it was the last thing I wrote in my notebook. And then I was raped 2 weeks later and battled to get antiretrovirals. I went to 3 different hospitals. At the 3rd hospital, I grabbed the doctor in casualty and I said, I want those drugs and I want them now.
You have to force them. You have to tell them, I've been raped. It is my right to have the medication. It is my right to get the treatment. It is my right to save myself from what I don't want to get.
In fact, the Cabinet statement of the 17th of April says immediate access to antiretrovirals for rape survivors. I'm not sure what government means by immediate because we've seen no access to antiretrovirals for rape survivors.
The whole question of PEP is quite complicated because are you going to get HIV because you're raped? What I would say to government is I understand their wariness and I understand their concern. However, we are dealing with one of the highest incidents of rape in the world in this country. And that's a fact. That's not fiction, that's a fact. And we're dealing with a situation where we're dealing with a sexually transmitted disease that although today is treatable, it's not treated in this country. It is also today incurable. We know we can prevent it from mother to child. We know we can prevent it when doctors get needle stick injuries. We're pretty sure we can prevent it in this situation. And, you know, let's be safe rather than sorry. I mean, it's that kind of approach. Prevention is better than cure.
From the police station, Gugulethu police station, they take you to GF Josta Hospital, where they've got Tutuzela project. And in this project, they help rape victims, they give them proper counseling, and they've got access to the antiretrovirals to prevent the HIV/AIDS infection. Unfortunately, I was never here because it was never here at that time. And I had no access to report the case right because there was no proper ways of reporting rape victim cases.
There's no reason why a doctor in a state hospital, if he has a rape survivor, cannot write out a prescription I wouldn't only criticise government because that's too easy, but I'd like to know why doctors in hospitals themselves, why isn't the South African Medical Association taking a position on this to make sure that our local chemist has antiretrovirals? Probably 95% of chemists don't have antiretrovirals on their shelves. We should demand that they do this.
ngingxaki yakho apha sifuna uba bekwenzeke ntoni nini noba uyewadlula police station okanye uze apha straight.
So ubuchule ukuba udlwenguliwe uhlala kweza areas lo drainage yalapha ubuchule kuba uze
we don't encourage that because mandithi let's say you are not injured or whatever. So we've got a problem here. We find that we are too busy. Our doctors are too busy here.
If they tell you you don't have access, you can't have drugs from us because you don't stay in certain area, you need to force them. They should do it to you. They should give it to you.
Many women after the experience of rape go into denial. Actually, the experience of rape has been psychologically likened to a near-death experience, where the inner scaffolding of a person's being is just shattered. And the response to that, for many women, is to go into denial and try and make as if everything's okay. And now you've got to take drugs, and every time you're taking a drug, it's reminding you that you've just been raped. And that it breaks through denial and makes the denial harder, if that's your psychological response. So we've actually, we suspect, and some studies have shown, that the compliance with post-rape medication is very poor. And that's possibly one of the reasons. Plus, of course, all the side effects.
Forget about side effects, because when you're raped, you don't even think about side effects. You just want to get the medication because side effects are better than having HIV.
Very many of us, after we've been raped, have gone through such trauma that we're not sure if we want to live or not. Don't make those decisions. Just go onto the drugs.
It's unlike me. I never had time. I was never offered anything. So now I'm HIV positive. It doesn't matter that I'm strong and I can cope with the thing. So while you've got the chances, you please take them. It is good for your health. I always tell people it is good. Go for it. Use it. Some people don't even have access to these things. So while you have access, use it. It is good for the people.